All right, it's time. We're going. If you ain't here, you ain't here. I don't care. I'm tired and I'm ugly. Bow with me. Gracious Heavenly Father, here we are again, asking you to forgive us of our sins, to say thank you for the day, to say thank you for letting us get out of here last night. Lead and guide us. Keep us in your arms. In my Savior's name, amen. Okay. I'm glad to see that y'all all got the message that we're having a meeting. This is proof that somebody sent that we've got that right. The others just did not adhere to it. Y'all know the rules, just one at a time. Mr. Wilkinson.
Mr. Chairman, members of the committee, I'd like to request Senate Bill 209 under modified open rule about halfway down the page. This bill clarifies that it is lawful to provide legal forms and documents to consumers only if there is conspicuous disclosure that the forms and documents provided are not the substitute for the advice of an attorney.
Are there questions? Mr. Willard.
Thank you, Mr. Chairman. Senator, one of the things we were discussing earlier is by conspicuous. It doesn't really define what that may entail as far as they're putting that noticing on their web page. And I wonder if that's something that we should try to address in the bill. Be sure that there is actual sufficient notice posted where people become aware that what they're buying may not be something they can rely upon from a legal opinion.
Well, I would hope that by conspicuous, of course, obviously, conspicuous meaning obvious and not easily overlooked and those kind of things, I would hope that conspicuous would be enough.
Now, may I follow up, Mr. Chairman? Generally, when we have things that are to be stated as far as publishing of a notice, we give a certain size or style of type that will be recognized as being large enough for the party reading it to be aware that that is a statement in there that they should be cognizant of, or of which they should be cognizant. Thank you.
Mr. Golett.
Thank you, Mr. Chairman. Senator, I think I'd echo Chairman Willard's comments. I understand the motivation and where this is coming from. I'm looking at LegalZoom.com, the documents from the website itself right now. The disclaimer that I see is very, very small, and it's in what's conventionally known as mice type. And then when I'm turning the page, I see another page that says our comprehensive will package includes hands-on attention from an experienced attorney during your free 30-day trial of Legal Advantage Plus. So I see that there's an attorney aspect to it, but then I see in another place on the page that disclaimer that there's no attorney-client privilege and there's no attorney-client work product that attaches as well, confidentiality. So I understand where you're coming from on it. I just think there are concerns about disclosure and notice so that consumers understand with their eyes wide open as to what it is and what it isn't. Chairman Willard makes a good point in that there are many times in the code. I work in the insurance business, and we have lots of inserts that we have to put into our renewal notices that dictate a certain font, size, etc., on certain disclosures that are mandated by the state. So that's just a concern that I would have off the top of my head. I understand where the gentleman's going, and I'm not trying to be a problem with it, but it is, I think, a legitimate concern given the gravity of the nature of the documents that we're talking about, like a will, someone's life we're talking about. So I just leave it with that, and I appreciate your listening to me on that.
Any other questions? Thank you.
Thank you, Mr. Chairman.
Mr. Miller.
Thank you, Mr. Chairman. I bring you under modified open SB 301 which provides as an option that we can now use wood construction in our schools. It's being done in other states. This bill's been endorsed by the Farm Bureau, by the Forestry Products Association. And keep in mind, this is treated wood, and it's got to be subject to minimum building codes in our state: fire sprinklers, fire alarms, ingress, egress, etc. The advantage are square footage cost is probably $20 to $40 less. It's got much smaller carbon footprint. Governor Deal actually did an executive order earlier this year urging us to use forest products in our state buildings, government buildings. And really, the only detriment, I guess, would be the insurance costs would be higher, wood versus non-combustible masonry, but more than offset by the square footage savings. And it's being done in other states. And it's a key industry for us in the state. All it is an option. That's all it becomes. I'll be happy to answer any questions.
No questions. Thank you.
Thank you, Mr. Chairman.
Ms. Unterman.
Thank you, Mr. Chairman and members of the committee. I appreciate being able to come before you. I bring forward on the only page you have in the modified open rules, Senate Bill 65, mental health. This is dealing with licensed professional counselors. This bill is left over from last year. As you may know, in South Georgia and in rural areas, we have a deficit of professionals, especially psychiatrists, psychologists, and anyone who deals with 1013s. And that's the ability to be able to help people that are in mental distress. And this bill comes forward helping in those particular areas to be able to do that. And Representative Houston is going to carry that bill.
Any questions? Next one. Do the other two.
Okay, and Senate Bill 291 and 292, Senate Bill 291 and Senate Bill 292 are both bills that are the result of a 75-member Alzheimer's and related dementia task force that has been meeting in the past year. The first bill is reorganizing the Division of Aging Services to be able to have the capacity to deal with the aging baby boomers. It's a lateral move. It is not a new agency, and there's no fiscal impact on that particular bill, and Representative Cooper has agreed to carry that bill. Senate, do you want me to go to the next one?
Yep.
Senate Bill 292, the Alzheimer's Disease Registry, will be located in the Department of Public Health. We have put money into the budget for that particular cost. The purpose of it is to know exactly how many folks in the state of Georgia that we are taking care of that have Alzheimer's, to know the physical impact, and to be able to have community-based services to take care of them in their home.
Mr. Setzler.
Hey, Mr. Chairman, to the chair lady, are there any other conditions that we maintain a database of folks with certain?
Yes, there are. There's quite a few. If you look at HIV/AIDS, and when the AIDS epidemic came along, we keep a registry with them, I believe, and also communicable diseases like tuberculosis, things like that. And it's to know not necessarily the person, but it's to know the location, to see if there's pockets, to see if there's any familiarities with the disease process, and to also know where you're going to put your services in the state of Georgia.
And I asked that question because I can understand from an HIV perspective or from a communicable disease perspective, there's a public, sort of a direct public health interest in understanding who can potentially affect others. I just, were there no privacy concerns about this?
You have the HIPAA laws, first of all, and you also have a redaction of the names. We don't want to know who the people are. We're just keeping statistics so that we know. We do not know in the state of Georgia how many people have Alzheimer's, and when you're sitting down here and do the physical cost of that and trying to determine, you know, who needs to have community-based services, who needs to be put into a nursing home, and how you're going to take care of the Medicaid and dual eligibles is very important. Does that answer your question? Maybe not.
It's a conversation we can have through the process. I wanted to raise, it was a concern that I mean, some government entity somewhere has the test key that knows this individual is linked to these conditions. I mean, it may not be public knowledge, but somewhere that's kept in a database. I have a broad concern of government registration of
Mm-hmm.
these kinds of a variety of conditions.
Mm-hmm.
And I'm persuaded we ought to tread very lightly on
Mm-hmm. Well, there's many disease processes that statistics are kept on, and fortunately for the universities and research, that's a good thing. But I understand your privacy concerns, but I think HIPAA laws, the federal laws, oversee anything that the state does anyway.
Any other questions? Thank you.
Thank you, Mr. Chairman. I appreciate it.
Dr. Burke.
Thank you, Mr. Chairman and members of the committee. I've got two bills under the modified structured rule, the last two. The first one is Senate Bill 273 that would require the Department of Public Health to establish a maternal mortality review committee to review maternal deaths. Georgia's one of the worst states in the country as far as the numbers of maternal deaths. Be glad to answer any questions.
Ms. Abrams.
Thank you, Mr. Chairman. To Senator Burke, can you explain why this information is kept confidential? The way I read the language, no other entity within state government or other organizations that could use this information would have access. Can you talk a little bit about the confidentiality language?
Yeah, that's real important from the, number one, there are HIPAA or confidentiality laws that would have to be followed from a federal standpoint. And number two, the reason for this committee is just to get data, similar to what Chairman Underman was saying about Alzheimer's. It's not to judge that case from the standpoint of did something bad happen or was somebody at fault. It's to get data so the Department of Public Health can decide if there are some public policy changes that need to be made statewide. So that's the point of the committee.
May I ask another question, please? So I understand not wanting to use it for liability purposes. I'm comfortable with that. But my concern is that it includes data that could not, I mean, HIPAA rules usually apply to information that can identify the person in question. But the additional data, the aggregated data, the way I read this, even the aggregated data would not be available for public use, and that's my concern. Is there a reason why we would restrict the aggregated data, not the personal identifying information?
Well, I think the department wants to be able to see what the data is and then make a decision, you know, what the best use of it is. I think they were requesting that. The other issue is to truly get what we would call real data, because obviously people are very sensitive about these types of events. And even though we're one of the worst in the country as far as our numbers, we're only talking about 90 to 100 cases per year, and it would be very easy from the standpoint of that data to be identified to a certain case somewhere in the state if we're not very, very careful.
Thank you.
Ms. Cooper.
Thank you, Mr. Chairman. May I ask the minority leader what other group outside public health is she considering might need this data?
What outside of public health, what kind of group? So there are groups like Neighborhood Nexus. They're aggregating data that just provide information about sort of the state of the state. So they use not necessarily the particulars. The way I read this, I just see this as overly broad because I completely understand wanting to restrict identifying information. But if we're collecting data about the level of health mortality, and we have a higher level of mortality in Southwest or maternal mortality in a certain area of the state, that information would be restricted only to the Department of Public Health. No one else would have access to this. Any nonprofit that wanted to target services in that direction could do so because they wouldn't have access to that information because we've restricted any of that aggregated data from being provided to them for their use. That would be my concern.
But wouldn't it be up to the health department to sort of, I mean, I think that's
They're restricted from doing so. They cannot share that information. The way this language is written, they're not allowed to provide that information to anyone under the circumstance without violating the law. That's what the concern about.
Thank you, Mr. Chairman.
No more questions. And you got another one?
The other bill is Senate Bill 342, and this is basically a department bill from the Department of Public Health about disclosure of HIV status to healthcare providers. Be glad to answer specific questions, Mr. Chairman.
No questions. Thank you.
Thank you all.
Mr. Caldwell.
Thank you very much, Mr. Chairman. Members of the committee, don't worry, I did not forget. I know crossover day happened. I am in the right rules committee. I have an urging resolution that I'd like to present to you today. It is H.R. 1280. It is the second one down in the modified open rules section. This is a very simple urging resolution. It urges the federal government, both the United States Congress and the executive branch, to continue negotiations on the Transatlantic Trade and Investment Partnership. That's a fancy way of saying the U.S. and EU trade agreement. You may have heard about what's going on with that. It's still in the early stages of negotiation, but the entire goal of the trade agreement is to pull away trade barriers from the U.S. and the EU as they go back and forth trading. The transatlantic trade is by far the largest economy anywhere in the globe. We comprise about 1/7 of the world population, and yet we comprise about 65% of the total global commerce. If you want to get your biggest bang for your buck, you go attack that. Problem is, it's on a steady decline because it's becoming so difficult to navigate the government bureaucracies on both sides. So both entities have come together and recognized we need to get some of that out of the way. So this does a very simple few things. The TTIP would. It would remove trade barriers, it would line up regulatory agencies, and it would make it easier to trade back and forth. It's a free market initiative. This resolution in itself, all it would do is voice Georgia's support. Texas and Tennessee have both done that already. Governor of Alabama issued a letter to the president a few weeks back doing the same. This passed unanimously out of the House Committee on Economic Development and Tourism. I want to thank Chairman Stevens for his help as we've moved it through there, and I present it to you for your favorable consideration.
No question. Thank you.
Thank you, sir.
Mr. Albers.
Thank you, Mr. Chairman, members of the committee. I am back in front of you for Senate Bill 207 under the modified structure rule. You were kind enough to pass this out last year, and it missed on day 40. I've mentioned it a couple of times, but a quick refresher. This just assures that those who get first offender status will still be flagged if they try to get a job in-home health care. The same way we do it for a nursing home or a school or anywhere else, this will surely help protect our senior citizens. And if there are questions, I'd be glad to answer them. If not, I'd ask for your favorable passage.
Mr. Roberts.
Thank you, Mr. Chairman, and I do apologize. Books down there, so I had to look back at it. On first-time offenders, does it spell out in there for what offenses?
It does not. It's when you fall under first offender status, there are a couple of areas that you'll be flagged if you try to go back into that same place that you committed the crime. So as an example, if I committed a crime in a nursing home and I went back to apply at another nursing home, it would just flag me. It will not flag them if they want to work at Home Depot or McDonald's or anywhere else, because we want people to have a second chance and be employed. We just don't want to put them back in that same environment if they had done anything to our most vulnerable citizens.
So felonies or misdemeanors? All?
Yes, both.
Thank you.
No more questions. Thank you.
Thank you, Mr. Chairman.
Anybody on the committee? Mr. Benton, in a new spot.
I'd like to put my name aside Senate Bills 291 and 292. That was Senator Underman's bills. Two bills came from the Alzheimer's Task Force. We spent about 7 months meeting all over the state, and these were two pieces of legislation that we felt like needed to be brought before the General Assembly. Thank you.
Mr. Hamilton.
Thank you, Mr. Chairman. I'd like to put my name by Senate Bill 209. I heard the councilors' concerns of that, and I see this a little differently. I see this as a very good consumer-friendly bill. And in looking at the bill, it says that if the product clearly and conspicuously doesn't state that, then they do not get the protection that they're asking for. So to me, it's up to whoever produces these to do that, or they will not receive the protection that they're applying for.
Ms. Cooper.
Is it working?
Yep.
So, thank you, Mr. Chairman. I would like to put my name, like Representative Benton, for 291 and 292. I also served on that Alzheimer's task force, but also Senate Bill 273. I believe the Public Health Department would not release specific information, but they would identify with the information areas of our states that needed help, and so they would get what the minority leader asked for, but just not the raw data. And I'd like to ask for Senate Bill 242.
Anyone else? Mr. Willard, do you want to make your motion?
Thank you, Mr. Chairman. I've been requested by the chair of the Juvenile Justice Committee to ask that House Bill 1053 be resubmitted to his committee.
You have a motion and a second to recommit HB 1053 back to juvenile justice.
Yes, sir.
Any opposition? It's done. Okay. I'm going to set another one of these big calendars. You all have the blue sheet in front of you, so you know your choices are limited at best. And at worst, all of them are Senate bills except for 3 resolutions. Modified open, H.R. 1038. Any opposition? It's on. Modified structure, SB 207. Any opposition? It's on. Modified structure, SB 273. Any opposition? It's on. And so as to give us a choice of something to do for the following day, that's it.